Hello, and welcome to our discussion with important people. And I couldn't think of a better person to start this off with on Black America Web is Dr. Michelle Albert, history maker, cardiologist, and just an all around incredible woman. Dr. Michelle Albert is the new president. She is the 86th person and the first Black woman to serve as president of the American Heart Association. That's right. And you can see her nice outfit. She's pushing the business as well. Hello, Dr. Albert. How are you? And welcome.
Good day, Ms. Wilkes. It is really an honor to be here on the program today. So I am really excited to enter into this conversation with you.
Well, I am too. Ladies and gentlemen, if you think that you have an impressive resume, I can pretty much guarantee it's nothing compared to Dr. Michelle Albert. But Dr. Michelle Albert, we're going to talk about you, where you come from, all of that good stuff. But let's talk about you and the business of the American Heart Association right now. How did you first get involved with the American Heart Association?
So absolutely. I've been a volunteer for the American Heart Association for about 20 years. And I got involved as a cardiology fellow when I was training in Boston at the Harvard Medical School and Brigham and Women's Hospital, and began, being involved in committee work for the organization, in part because the organization is focused on, sort of heart disease advocacy related to heart disease in all populations, but as well as science. The AHA is a science-based organization, and I'm also a researcher. So that both things, the advocacy component as well as the support for young people like me at the time.
And still.
Research. I still think of myself as being pretty young.
Yeah, you are. You are pretty young, and for one who is so accomplished. Just in terms of the American Heart Association, so you started volunteering as a fellow. Are they ever going to change that to distinguish, or is it a need to distinguish between a male fellow and a female fellow? I'm kidding.
I was going to say rephrase the question.
I don't know if there's so much about pronouns and descriptions of oneself and everything. I was wondering if they're ever going to, try to make the fellow different as a female fellow as opposed to a male, but just having fun with
important points related to gender that we all need to have a sensitivity about and be very inclusive as a population. Yeah.
And so let's talk about that. Let's talk about the sensitivity that organizations such as the American Heart Association has endeavored to bring about, and that is about providing service and information to men as opposed to women, and primarily white people as opposed to people of color. Did you find that this was something of great concern to you as you started out in your career in cardiology?
Well, certainly you might be aware, Sybil, that in cardiology is predominantly a male, specialty. Only 3 to 4% of cardiologists are African American or Black, and only 6% are Hispanic. And certainly in terms of women, only about, sort of 12, 13% of cardiologists are women. And so this is a very, very important area that the organization is concerned about. And in fact, over the last several years, with its focus on health equity, there has been an intention to ensure that at science conferences that there's a balance in terms of gender, in terms of being more inclusive to for example, the LGBTQ plus community, as well as ensuring that from a racial and ethnic standpoint, that there is appropriate representation in presentations and in participation in committees, et cetera. So there is an intentional focus around that. But I think more importantly, there is also a focus on ensuring that the work that the organization does at a community level, advocacy level, and science levels, that it is inclusive and focused on healthcare disparities, which are rampant and were very illuminated by the COVID-19 pandemic, because we had all of these disparities in cardiovascular outcome. 1 in 2 Black women, for example, will die of a cardiovascular condition compared to 1 in 3 women of other races and ethnicities. So the organization has had a real big focus on this in the last several years, and actually longer than that in the funding of science.
And I dare say, and I'll pose it as a question: was this a concern of yours early on in your career? Was this something that you pushed for as you advanced through the area of cardiology?
Absolutely. So being a Black woman in cardiology is a rare thing still.
Hmm.
And, I've always found that in my training experiences, a fair amount of isolation, actually. And I was lucky enough to have mentors who believed in me and saw that I was putting in the time, and that I've always been actually very focused. So what I did was I ensured that I actually got fairly classical training,
Hmm.
while at the same time branching off and focusing on socioeconomics and cardiovascular disease in my research, focusing on race, ethnicity, and cardiovascular disease in the work that I did, in addition to the usual things that people would do. At the time, none of that was, when I started doing it, was so embraced in the
Right.
cardiovascular sphere, and a lot of that was very lonely. But I reached across the aisle, found mentors outside of cardiology, and I think this is a very important point. When you find yourself in circumstances where you might not be, sort of getting the whole you developed, you have to reach across the aisle and seek out others who are in other areas,
Hmm.
and that was in psychology and psychiatry and sociology. And so I have mentors across the spectrum in medicine and outside of medicine. Many of the Black women who've mentored me in my career are not in cardiology, because there
Hmm.
are not many of us in cardiology. But I have Black women mentors who are outside of cardiology, who are outside of medicine, frankly,
Hmm.
as well, who've helped, to support me, yeah, and have a
That's great
significant.
advice, especially for young women that are watching us today and who are venturing off in an area that may not be, especially if you think about the STEM field and science and technology and what have you, where there aren't a lot of people that look like you, look like me. And so to give that, your experience in that and reaching out beyond your core area of expertise, that really speaks to your recognizing that, and as you say, reaching across the aisle to people who look like you but may not be along the same career path as you.
And I think also over time, if I may just step in another second there, is that it also enhances your ability to be creative, right?
Hmm. Hmm.
Because
You're thinking outside of the box.
right, and also you're leveraging, sort of other principles that may be occurring in other sectors, right? And so you combine, different things in order to create or help create other avenues and paths and ideas that may you won't ever experience or see by just staying in your own,
Yeah,
corner.
yeah, exactly. The scenery doesn't change if you stay in your own little, and your scope of thinking does not change either if you stay in your box or stay within your four walls or whatever. And so I think that the advice that you have gleaned from all of this is that there's a big world out there. And from my research on you, your travels and things like that, as well as your growing up, has exposed you to worlds outside of the continental United States and what have you, and your experiences have brought you to where you are.
Absolutely, and I grew up, as you've probably read, in Guyana in South America, which is considered part of the Caribbean. And there, I had very early exposure to disadvantage
Hmm.
and how disadvantage interfaces with health to cause poor health outcomes,
Sure.
especially cardiovascular outcomes. And then I came to Brooklyn, New York, when I was a mid teenager, and I consider Brooklyn, New York, sort of home. And saw, and that was in the mid '80s, and
Oh,
saw
wow.
a lot of sort of the stuff that happened in the mid '80s there,
Hmm.
and had to be fearful for walking out to the street corner and being fearful that you're going to get gunned down in a drive-by shooting or something like that.
Yeah.
And so I think bringing those lived experiences to what I do in science, and also what I do when I interact with patients, is really, really important.
You're working as a volunteer. How did that color your experiences as you came to the highest point, it being the president of the American Heart Association? Because it's one thing, I think that when you talk about people starting out in a business, some of us are given the advantage of perhaps a parent owning the business. And so they, start at the top. And then some parents say, no, you start here and you work your way up so you can understand the full scope of the business. Is that what you brought to your position today?
Well, I think actually that's the thing that most presidents in these organizations bring to American Heart Association. As I mentioned, I've been at least a 20-year volunteer.
Mm-hmm.
And what that means is that you're involved in the organization at different levels, at the
Right.
science committee levels, at the advocacy level, at the local level. So I've been involved at the local level when I was in Boston. I've lived in Boston for 16 years there. And then in the Bay Area here where I live now, being involved in the Western states. I was president of the Western state of the board for the Greater Bay Area Board of Directors and the San Francisco Board of Directors.
Mm-hmm.
I'm also on the Western State Board, as well as doing all of the committees that you're involved in nationally. Your question is a really, really important one, because I feel like a lot of people want to, sort of have these aspirations of being in leadership spots and so forth. And actually for me, I didn't aspire to say, oh, this is what I want to do. But I rolled up my sleeves and got involved at various levels. And I think that things just worked out.
I'll say they did. And here we are. And it's not lost on me that here we are at the beginning of not only American Heart Month, but Black History Month. And you are making history as the first Black female president of the American Heart Association. How does that feel? What does that mean to you?
Yeah, so I want to step back and also say, as the first also woman of color and Black female president of the American Heart Association, I think it's, an important time, and I wouldn't want to be the last. Mm-hmm. And I do a lot of mentorship and sponsorship. And so for me, being in this position is a position where I hope to continue to have experience and influence in a way that helps to cultivate those who are coming behind me. And that's how I look at this. So this is how it feels for me. It's not about Michelle Albert being president, but many others being president as well.
We are talking to a real trailblazer here, Dr. Michelle Albert. She is the first Black woman, and she said woman of color, to serve as the president of the American Heart Association. And Doctor, I do want to talk about your growing up years. I'm fascinated by your growing up and then, your parents bringing you to New York. But please talk about how the way that you were raised and how it affected the way you deal with patients and others in your business.
Right. So I was actually raised by my grandparents, as my parents had gotten a government scholarship. So my family, I do not come from wealth. They got a government scholarship. My father got a government scholarship to go to England to study mathematics and actuarial science. So I spent my early years being in an environment which is a working class environment, but actually having the opportunity to, because of testing in and so forth, into going to some of the best schools in the country. What that enabled me to do is actually see different worlds, right? See the world that I was living in, the world that I was getting exposed to in the school system, and seeing how persons are treated differently based on class and race, right? And that sometimes there's not the empathy there for people who don't have your similar lived experience and so forth. So what that taught me early on was that, it is extremely important to be able to respect and to actually place yourself in the spot of others who may not look like you or even, share your same, goals and aspirations. And so when I meet a patient, whether that patient is a really wealthy patient or that patient is someone who has no resources, ensuring that you meet people where they are and treat them with empathy and understanding for what their situation is. So I think my early life experiences really helped to hone in that skill set in me.
I think that is so very important. And I think that I was just in a hospital with a friend, and just seeing the hard work that goes into caring for a patient, and the nurses who were just so gracious and so wonderful in helping my friend go through a difficult time. But they too have that same sense of meeting people where they are. And I think that's really important in that profession in times where the strife and the emotions are so high with all of this, and making people feel that their need is of your highest importance.
Right.
And that's something a lot of people say that they don't get walking into a doctor's office these
That's
days.
true. And certainly if you're a person of color, especially a Black person, there is bias in healthcare. And that is why it's really, really important to have persons in healthcare who come from all different backgrounds. And as you know, there is a need for Black people, Hispanic people, Native Americans, as well in medicine. And for me, certainly that's one of the reasons why I am very involved in admissions at my institution, which is on University of California at San Francisco.
Talking about the American Heart Association and the awareness that you encourage and bring to this position as well. I was told about your speech at the American Heart Association Scientific Sessions Conference, and you said many jarring statistics illuminate a marked wealth gap by race and ethnicity. Could you expand on that? I mean, we started talking, but could you expand on that in reference to what you said to the audience?
Yeah, so my presidential address, which was this past November, focused on economic adversity. And just my research currently, I lead a research center called the Center for the Study of Adversity and Cardiovascular Disease, or the acronym is Nurture Center. So I do research on what we call the biology of adversity. So I use the example of economic adversity in my presidential address to, talk about health. The jarring statistics I discussed related to level of education and its intersection with race and ethnicity and wealth. And if you are a Black person and you have a college degree, you have similar wealth to a white person who has a high school degree. And although having higher levels of education will increase your income and your wealth, because of bias, discrimination, that exists related to race, ethnicity, and other factors. You see these marked, wealth gaps by race and ethnicity. So it was important for me to highlight that to the audience, because many people think that, if you have a MD or a PhD or, if other advanced degrees, that that someone may be wealthy, but that's actually, not necessarily true.
And let's talk about student loans.
Well, it's student loans, and frankly, from a healthcare perspective, we know that, and this is another thing I pointed out to the audience, that generational wealth is associated with generational health. And in fact, you've heard a lot about redlining and all of that, and much of the wealth, for Americans at least, is in their owning of property. And because as people of color and especially Black people have been redlined and sidelined from owning property and being able to have certain educational experiences that will allow an advantaged wealth we can end up in the circumstances that we are in, not just only in America but internationally.
That's a lot. That's pretty heavy, but breaking it down like that makes it so that everyday people can understand and appreciate where you're coming from and how you are seeking to break that gap, or to bridge the gap in the chasm that exists there.
Absolutely. And I think as we look forward and we think about science and we think about, the delivery of healthcare,
Mm-hmm.
it has to move towards incorporation, what we call the social determinants of health and social factors, into the delivery of healthcare. And that means not just only working with social workers and other social navigators, but it also means as a scientist, I'm a scientist, as I think about science and as my colleagues think about science, is that incorporating how social factors affect the delivery of care to the populations that need it. And I know medical schools are beginning to focus on that,
Mm-hmm.
but I think diversification, racially, ethnically, in particular in healthcare, is an important element of delivering better healthcare.
Before we move into Michelle Albert, the person and the growing up in Guyana and what have you, we're going to conclude this section and talk about American Heart Month and Black History Month, and what you see as your initiative to raise awareness and the consciousness of heart health, and especially within the communities of color.
Right. So I would say several things. Certainly for Heart Month, the American Heart Association is really focused on the issue of CPR,
Yes.
and this was long before the high-profile cases that we've seen recently.
Mm-hmm.
The focus is on having at least one household member in every household know CPR. So that's really, really important because 70% of cardiac arrests will occur in the home.
Right.
And certainly there are huge disparities by race, ethnicity, with Black Americans in particular having the lowest performance rates of CPR on a person who is Black. And so that's important. We also know that from a gender perspective, compared to men, women are less likely to get CPR in the public setting.
Right.
It's interesting for Blacks are less likely to get CPR in the home as well as in the public setting as well. So these are things that the American Heart Association is focused on for Heart Month. And certainly, as you know, there's the intersection with Black History Month as well for Heart Month. So really knowing that these disparities exist, really getting people of color and all people actually to learn CPR is an important element. From the aspect of sort of my presidency, it's bringing the focus on adversity and cardiovascular disease to the forefront of what we do in the American Heart Association, and attending to that. The presidential address focused on economic adversity, and that's part of my platform, a major part of the platform, because I don't believe that we are going to be able to solve healthcare disparities without actually solving the economic disparities that exist.
Yeah, absolutely. I'm proud to say that I'm a part of the Be the Beat campaign.
Yes.
And my partners and I have so we have more than one person in our company that is now CPR certified to do this, and hands-on CPR. And it's I'm really impressed with myself, doctor, that I went through this, because it's not just just beating on the chest. There is a concentrated effort and steps that you have to go through in order to keep or to engage a person's heart if it has stopped, and to keep it going until those who are more proficient and schooled in this can come and help that person and carry them on to a place of help, meaning a hospital.
Right. And I would be remiss if I didn't, say that very importantly, it is, if you do see someone who is not responding, you should approach them, you shake them, ask them, say, can
Can you
shake their
hear me?
hand?
Can you
Can you
hear
hear
me?
me? And if they can't, and they're not responsive, make sure you can put them in a flat, firm surface, and get into the middle of their chest with the not the palm of your hand, but the part of your hand that's below your palm of your hand, and you interlock your hands, do CPR, press on the chest, and you go for 100 to 120 beats per minute. And you also, before you actually do that, you need to ask someone to call 911 and to get help. And if there's no one else there, you call 911,
Right.
put your phone on speaker while you're speaking to 911 and continuing CPR. Also, that allows the 911 operator to give you instructions if you need instructions. So that's, and you continue CPR for at least 2 to 4 minutes, waiting for care to get there.
And it really, I mean, I realized how out of shape I was, and knowing, because that is an extreme amount of work that you're doing, and thinking about it, 100 to 120 beats in a
Right.
minute.
Right. I would say there too, though, that it is a lot. It is a lot of work, and but use your adrenaline
Yes, and I
to
think that
keep you
works for you.
going, and I
Yes.
think that's important. And I think the other point that I would want to make around the CPR is that many persons will say, what about if I break somebody's bones, or I hurt them, and I would say, well, you can't hurt them more. They're
Then that heart
alive.
stopping.
Their heart stopped, and also bones can heal. Right.
Mhm.
So you just want to do the CPR and most likely you will be saving the life of a loved one,
Wow.
since 70% of the CPR cardiac arrest is happening in a home.
Wow. Well, I'm a part of the Be the
B2B
Beat
is the American
campaign,
Heart
and
Association campaign. Yes.
as well as, the dance to check it, cuff it, and do all of that
Thank you
with
for
your
doing that,
with
Sybil.
your all of the blood pressure thing. So it's really important. I am fully on board, and I want to encourage people to also join and be a part of the Be the Beat campaign, because it is a life-saving issue and a measure that all of us can be a part of, and we can save lives. We
Yes.
really can. And when you least expect it. I mean, as you mentioned, recently we've come upon the discussion of this, but it's really important that we all be, at least one person in the household or the business, be CPR certified.
Yes.
Absolutely. Doctor, let's take a move here, and let's talk about little Michelle growing up in the Caribbean. You mentioned that your parents were going to school. They got scholarships to go to school and study in England, and you were raised by your grandparents. Tell me about that.
Yeah, so obviously I love my grandparents. They've passed away at this point. We lived in a community where there were 3 houses in the yard. We lived
Mhm.
in the yard, the house in the back, and they were they were disciplinarians, but not sort of overly so.
Mhm.
My days were spent, I woke up, sort of had breakfast, went to
Mhm.
school, came home, studied. I was always somebody who, sort of was very focused. My sister would say, Michelle was always there sitting, staring out of the front window, thinking about, dreaming
Big
about.
thoughts.
I don't know about big thoughts. I don't know about big thoughts, but certainly I was always dreaming about life for the future and
Mhm.
so forth. I would say that because of the working class environment, I did not have a lot of access to sporting activities and the typical things that you would do growing up as an American kid.
Mhm.
But I did see that on the other side with kids who went to the schools I went to. I had a pretty uh,
Was it idyllic in terms of just the freedom to grow in a sunny clime, and with grandparents who loved you and nourished you, and that kind of thing? That's what it seemed in reading your story. That's what it
yeah.
seemed like to me, and what a great influence your grandparents had on your life.
Yeah, and my grandparents, my aunt also lived in the household as well. And obviously, I don't want to not say that, not mention my parents
Of
too,
course.
who were also, sort of providing. And it was, I had a happy childhood.
Hmm.
I have no major complaints about.
And you're not sitting on somebody's couch recounting all of these events in your
Well, the
life.
thing is, it turns out I'm not, but I think for those who actually do need help, and need to sit on somebody's couch, that's really important that they
Right.
do so, right? But for me, I don't have any of the traumas
Hmm.
to
Hmm.
report from childhood experiences. My family was sort of very loving, and yeah.
And your grandfather influenced your choice of your careers in a sense.
Yes, yes. My grandfather had cardiac arrest when I was about 14 years old.
Hmm.
And I do remember that we were at home and he had gone out to do an errand. And our next door neighbor came running to the house saying, your grandfather, his name was Charles, had just died at the street corner. The important element about that is that he didn't get CPR.
Hmm.
And also there were no AEDs because, it was at the time, it's a third world country. And
That's
and
the
the
defibrillators.
defibrillator,
Hmm.
no defibrillation, no CPR. And so he passed away. In retrospect, after I went to medical school, I realized that he probably had what we call heart failure leading up to that, because I remember
Hmm.
the week before that, he had spent a fair amount of time in his room and his legs were, pretty swollen, etc. And likely from fluid overload related
Hmm.
to heart failure. But that did influence my interest in going into cardiology specifically. Prior to that, I was interested in, sort of studying mathematics,
Hmm.
and had an interest in science and biology because of, as I mentioned, the disadvantage I saw in its intersection with health. But that really propelled my interest in cardiac um, medicine. And interestingly enough, early on, I was interested in being a cardiac surgeon. And
Ah.
I went to medical school at University of Rochester in upstate New York.
Hmm.
And I quickly realized that because of also my interest in wanting to do research and advocacy work and so forth, that, if you're a surgeon, you have to be in the operating room all of the time.
Right.
And
That's your day.
right, that's your day. And so began to become more interested in cardiology, which allows you to do it has procedures. It allows you to do patient care in a critical care setting, allows you to be in clinic, allows you to do research, allows you to do a whole spectrum of things. So one of the messages I would like to get out, as we're
Hmm.
doing this interview here, is to young people, to say that don't be scared to, sort of pursue a career in medicine. The career in medicine is a long journey,
Hmm.
but you can, sort of get assistance, along the way. You can get support from mentors across the country, organizations like the American Heart Association. I also want to give a shout out to the Association of Black Cardiologists, for which I served as president previously as well. Where you can get tied into mentors who look like you,
Hmm.
both of those organizations, to help nourish your career. In fact, the American Heart Association for sure has a HBCU, historically Black college, and historically Hispanic scholars program that you can get involved in. And then I think similarly, the ABC, consists of most of the Black cardiologists in the country,
Right.
and can provide that paced in as well.
And if I may say, I believe it's Morgan State. Is it Morgan State that just opened up? They're going to have a medical school there in Baltimore,
Yeah,
Maryland.
I've
Speaking of
just been I've just
HBCUs.
been reading about that, and I think that those things are really important because, because of the Flexner report and all of the other things that happened in our history,
Hmm.
there was a shutting down of Black medical schools
Right.
over time, and so there's only a certain number of Black doctors that were allowed to be trained.
Yeah.
And that has a huge influence at our community level, because you can't be where you don't see a lot of the time.
That's right.
And so it really is important to have persons, who are in medicine actually be at the community level, so that young kids actually can see that this is something that they can do. The other thing, one of the things my father actually drove home to us very early on is that, if you're in a profession, it doesn't mean that if you're going to go into medicine, it means that you need to be a doctor only, right? There also, you can have physician assistants, you have nursing profession, huge. You mentioned Sybil, the nurses, how great they were when you were dealing with your friend in the hospital. There are, people who are physical therapists. There's a whole team of people who ensure that we receive the care that we need to receive. So I say explore it. Explore medicine as a career, and think, and you can do it. Everybody, I feel, should, if they're interested in that pathway, at least try.
Are you a good patient?
What kind of question is that?
I'm fascinated when people are in their business that they're in, and they have to, be one who accepts help, or in a not in a submissive position, but certainly in one that is different. And you have this wealth of experience and going in to see all of this.
Well, the way that I'll answer that question is to say that I am good. I'm a good taker of advice, right?
Okay.
And so when given advice, I listen to it, and hopefully approach the response to the advice in a thoughtful and leveraged way.
So you can be a good patient.
I would think I'm a good patient.
Okay. And can you also tell me, do you remember, like, when you had your thoughts of becoming a cardiac surgeon, or perhaps, in pre-med, have you ever held a heart in your hand?
Well, so I think for all students, all medical students, when you enter into medical school, one of your first biggest courses is dealing with a cadaver, right? And I have to tell you, I was so scared, because I am one of those people. I am really scared of cemeteries. I'm really scared of being and actually, I think growing up in the Caribbean a little bit, the cultures are such where it may influence you being scared of those things. And so anyway, I was very scared of dead bodies. And I remember shivering as I was thinking, oh my goodness, I'm going to be having to do anatomy and dissection. Right. And it is an anatomy and dissection where you first hold a heart, right? But once you get over that, it's okay. And then you start going through your rotations, you do your surgery rotation, you have, exposure to all the things that come along with doing surgery. And certainly, if you are a cardiologist, or you're a cardiac surgeon or cardiothoracic person, you are going to be dealing with cardiac arrests more so than others. And in that circumstance, beyond doing CPR, sometimes there's open cardiac massage on someone who you're trying to save their life.
Yeah. Do you remember the first life you saved?
I do remember the first cardiac arrest case I was involved in, but from a HIPAA perspective,
you're right. You can't share that.
But I do remember, and I think anyone who experiences that for their first time, it is has a huge influence on you.
Yeah.
You're very sad. I mean, every cardiac arrest that you're involved in, you're very sad. Any doctor can tell you that it is really tough to lose a patient. Interestingly enough, for me, one of the things that I find the most gratifying in my medical clinical practice, because largely over time I've been mostly involved in critical care cardiology, is actually walking patients through the death process and walking their families through the death process, because it's a very it's a very humbling
Sure.
experience.
Yes.
And I think certainly for me, I'm also a spiritual person, and
Hmm.
I know that there is a greater force that controls all of this. And so the being at that time, at that
Yeah.
such the most vulnerable time in a person's life, and also for the lives of their family members,
Yes.
is something that for me, I don't sort of take lightly at
For
all,
granted.
and you
Yeah.
don't forget each and every one.
Wow, that's powerful, doctor. I get tears. I'm thinking about. I wish that I had that when my mother passed away, and it's been 30 years this month. But someone to kind of take you through that process, the medical staff and what have you. But I think that's a beautiful situation and responsibility that you take and you don't take lightly. I commend you for that. Thank you on behalf of those who are able to benefit from that. So thank you so much. I do want to ask about Michelle, the girlfriend. What do you do for fun?
What do I do for fun?
Yeah.
So
Who are your girls? How do you hang out? What do you do?
yeah. So I love afternoon tea. Um,
Okay, that's very
yeah,
British.
I love afternoon tea, and I collect sort of teacups from
Hmm.
antique you know places and stores and so forth. So I love doing that. I love going to spa for massages and things. And I just love talking to, my friends. And, I have a network of girlfriends who are all over the United States, and we chat about different things. Yeah. And I love going on vacation with my husband. We love traveling a lot.
Where was your last favorite vacation spot?
So a recurrent vacation spot, in part because I'm on the West Coast, but I love going there anyway. I Hawaii
Me
is
too.
one of my favorite vacation spots, and sort of my husband and I spend a fair amount of time, when
That's
able
nice.
to go
That's
there.
nice. Hawaii is one of my. I'm pro uh, more favor of the island of Maui and
Yeah,
sometimes Kauai, but
yeah,
I've
absolutely.
been.
You and I we interface on that island of Maui, and
Yeah.
then when I'm on the East Coast, I love going to the Caribbean, and
Of course.
and uh, and I also love going to Italy.
Oh, we're right there, doctor. We're right there.
I think
um,
I think a lot of people like all those same places.
yeah, well, okay. That's probably true. And if they have had the opportunity to travel the way you have, and I hope that they will, certainly do that and check out those places. Do you get home to Guyana much?
I don't, and I actually haven't been in a long time. And my hope is to be able to go within the next year. Currently, because I'm in California, I,
Hmm.
um,
Traveling that,
I'm like 10 hours away
yeah.
in terms of the travel. So that's rough. And frankly, in part because of, just from a professional standpoint, the training experiences, the working experiences, etc., oftentimes make it, sort of just really tough to, go the long distance.
Doctor, I don't want to brag, but I did win the American Heart Association Reclaim Your Rhythm playlist selection. Thank you
Congratulations.
very much. Thank you very much. Um, it was with the help of it was not, it was a village that helped me get to that point. But um, do you have a playlist? Do you have favorite people, music that before
Yes.
you
Yes,
do?
I do. So like many people, I am a huge Beyonce fan. I'm part of the Beehive.
Oh, that is so awesome.
Yeah, I also like Jay-Z stuff too, right?
Hmm.
Rihanna, I love.
That's
And
Caribbean girl, yeah.
yeah, right. And Barbados, and actually a few people know her mom's from Guyana.
Oh, okay.
Yeah. So I tend to, favor those particular artists that I just mentioned to you. And
What's
I
that
also
one song that you never can miss? You go to that one song and it gets you going.
right, I like Halo from Beyonce,
Hmm.
you know.
I'm a
And
love on top girl, but I
you're
understand.
loving Top Girl.
Yeah,
I like Halo, and I like Diamonds
yeah.
um from from Rihanna. Yeah, shine like a diamond.
That is it, and you are absolutely just like that, shining like a diamond, and such an enjoyable conversation I've had with you, Dr. Michelle Albert. Thank you so much for joining us today. I wish you all the good luck, and in your position as the president of the American Heart Association. I hope we have the opportunity to talk again. And ladies and gentlemen, you've been in the presence of greatness here with Dr. Michelle Albert, this trailblazer, cardiologist, and the newest president of the American Heart Association. Congratulations again, doctor, and thank you so much for your time. I really appreciate it.
Thank you so much for having me, and this has been a wonderful experience for me too.
Thank you so much. All right, everyone. Thank you for joining us. On behalf of the American Heart Association, join us with the Be the Beat campaign. I want to remind you of that, to become CPR certified, like Dr. Albert and I are, as well as contact your local heart association and let's get started in some volunteer work with them and do good things for our communities as well as for ourselves. Be well, everyone. Take care.